To me, health is the whole body, so mind, body, spirit.
In functional medicine, I believe that there are 4 pillars of health. Food and diet is one of them, exercise is the other, sleep, and then mental and emotional health as well as spiritual health.
So functional medicine complements traditional medicine. We're looking for the root causes of what's happening with a patient. Leave all your preconceived notions of what it's like at an office visit at the door and just come ready to share your full story.
What we do is we keep peeling back that onion and trying to keep doing the detective work to understand the root cause of why you might be having a symptom.
I tell my patients when they come see me on their very first visit that I want them to know that I hear them.
A big part of it is patient education and patient responsibility. As a group, our providers cover all the bases.
And everyone has a very collaborative, integrative approach.
I think it's great that we have the multi-disciplines. We've got chiropractic care and acupuncture and multiple modalities to help get patients well, in addition to naturopathic medicine and a couple nurse practitioners and myself in the dietary world, as well as Lisa, who helps with the culinary medicine aspect. So we all come together working for the patient, and that feels really good.
We have the opportunity to focus more on those lifestyle changes that are going to help your chronic disease.
Keep an open mind when coming to these classes. We've got a lot of incredible tools in our toolbox, and we work to collaborate on optimizing the health of the people that we serve.
Health, to me, is having confidence in your body that you're able to live the life that you want to live.
Our goal at the Whole Health Institute is to help our patients feel really good now and in the future. When they do that, they can support everyone in their families, and they can show up in their friendships, in their relationships, in their careers. That is what I want them to know and rely on and trust us for.